Let me take you to the 50,000 foot level first. Talk about R&D in general. Global R&D landscape. It's about $2.3 trillion worldwide in R&D. A lot of money going into research around the world every year. Government and private. U.S., about 1/4 is government, 3/4 public and private institutions. United States, of course, 543 billion. Let me just say one thing, 2.3 trillion. If we take R&D and we compare it to GDP, worldwide R&D would be the 8th largest country. See the extent of what everybody is in on this game. Every major industrialized country is funding on research. The United States, 543 billion. China, 496 billion. Japan, 171 billion. So Japan is the 3rd largest investor in research and development. But the region of the world that's exploding, and this is why Japan is important, because Japan is in East Asia. Japan, China, and other Asian countries account for 67% of the global R&D. In the last 20 years, there's been explosive growth in East Asia, primarily driven by China, but also all the other countries, East Asian countries, are investing heavily in research and development. And when you look at global R&D, 35% of the global R&D it's very hard to get numbers on this, but based on my estimate, our estimate is 35% of the global R&D is health-related, $850 billion a year. So for 2 reasons, this forum is important. For 2 reasons. One, because collaborating with East Asian countries is extremely important, especially with some of the major R&D investors. And secondly, health is very much a very important component of worldwide investment in R&D. United States, in terms of the U.S. federal R&D breakdown, there's $143 billion a year by the U.S. federal government going into research and development. Defense spending is $69 billion. Health is number 2. Primarily driven by NIH and the HHS agencies. And then all these other areas, general science and basic research, a lot of it NSF, NASA, energy, environmental, agriculture, transportation, veterans, these are OMB categories. So in preparation for this meeting, I asked one of my colleagues here who had put together a word cloud of all CUNY research to provide me with a copy of that word cloud. And you can see that a lot of the health items are very, very, very much very prominent in the research going on here at CUNY. Health is human development, risk, HIV, community, care, cancer, behavior, disease, system, assessment. I mean, these are all terms that are very directly related to health research. So what is NSF's mission? David talked a little bit about NIH's mission. And clearly there's some overlap here, right? NSF was created in 1950. Its mission, as stated in the law, is to promote the progress of science, to advance the national health. The word health is in there. Prosperity and welfare, to secure the national defense and for other purposes. It was approved in 1950 by the 81st Congress. So health clearly was on the mind of the Congress when they created this agency, The NSF vision is to envision a nation that capitalizes on new concepts in science and engineering and provides global leadership in advancing research and education. The word health is not in there. So where does NSF begin and where does NIH end? I have to say that having reviewed tons of proposals at NSF and looked at many submissions, if you're submitting a proposal to NSF that is directly related to disease and directly related to researching humans and disease, it's probably not a good fit. I've seen proposals on cancer submitted to NSF that involve research on animals and humans, and some of those have been funded. The emphasis being on the animal research. So if you're conducting research trials on humans, forget about it. Don't think about NSF. If you want to conduct research trials on animals, it's probably not a bad fit. But more importantly, if it's very, very close, do exactly what David said. Talk to your program officers. They'll tell you exactly whether they'll fund it or not. They know their program's cold. They'll tell you, no, don't send it. You're wasting your time. Or send it, we're interested. It really is, we can't, the researcher does their research. Your expertise is in your research area. It's not in determining where it should be, your proposal should be submitted. That's their job. So I should say something about international partnerships, because I worked at the Office of International Science and Engineering. And what is it that NSF is looking for when researchers are forming their international partnerships? They want true international partnerships, which means that they want your partners to be engaged in the research in a very integrated way, not add-ons, not just we just need them there to look good or to make the research look good. They truly want true intellectual partnerships where they assume a good part of the research activities and the educational activities are embedded also with the international partners. They want there to be mutual benefit between the partners, international partners. They prefer new international collaborations, although if you have existing international collaborations where you want to advance the research and you know that collaboration will advance the knowledge in your particular areas, that can also be very easily justified in the proposal. They want an educational component. I don't know of any NSF proposal other than maybe some SBIR research that does not have an educational component. So students, junior researchers, a very essential part of NSF proposals. And they want you to think of this as your partnership, as a network that you're building. You're building with your community, within your communities, and you're building, and that is sustainable, that you can keep building upon to advance the research. So these are some of the core values of the International Office. These are the things that they are looking for. So how does it really, now having looked at what NSF is funding internationally, how does it break out? So most international research activities are funded by NSF disciplinary programs, not by the Office of International Science and Engineering. David mentioned that international funded is funded throughout all of the offices within NIH. Well, that's true at NSF also. Most international activities are funded outside of the Office of OISC. Now, OISC is kind of a baseline. It's kind of was created for the purpose of making sure that there is a minimum number of collaborative activities going on in science and engineering. So what is the funding balance between the directorates? Who are the most internationally active in terms of the directed funding? Social and behavioral sciences is the highest at 22%. Number two is math and physical sciences. And then you can see engineering is very, very high as well, the biological sciences. Now, international funding at NSF also occurs through another mechanism, which is the supplement mechanism. So if you already have an existing NSF award and you want to supplement it with some additional support, because you happen to think that an international partner can add a lot of value to your existing award, a supplement is actually not a bad way to do it. You can actually talk to your program officer and say, I'd like to add a Japanese researcher to my proposal, because I believe that Japanese brings something that can really help my research. Supplements are very, very common, and most supplements are funded through the Office of International Science and Engineering. So let me highlight a few examples of NSF support for international health-related research. Here's a U.S.-China collaboration on harnessing big data to understand and predict diversity and transmission of human and animal-infected avian viruses in China. This is a NSF-funded project, directly health-related project. The focus being using data to better understand viruses. Focus is not on necessarily on the virus, but on the method, on the tools, on the development of using big data in order to address an important societal challenge. Funded by the, it's a joint NSF, NIH, USDA program, okay? Interactive dynamics of reef fisheries in human health, 1.4 million, a division of environmental biology. US-UK collaboration, risks of animals and plant infectious diseases through trade. So how is it that disease is spread through trade? On ships, in packages, funded by the Division of Environmental Biology. Functional organization of navigational coding in the human brain. I'll talk a little bit about the BRAIN initiative, a very important program that began under the Obama administration and continues to be funded today. Early non-invasive diagnosis of liver disease with optical spectroscopy. Division of Chemical Engineering, CBET, in the Engineering Directorate. Again, the focus is on the tool to diagnose disease. The development of the tool to diagnose disease. Is that health research? You bet it's health research. Is it important health research? Yes, it is. Now, that kind of research is also funded by NIH as well. So you have two agencies that are looking at that are potential funders for that kind of, if you're a researcher in this area, you have opportunities. And then there's modeling and manipulating dynamic network activity in the brain. Again, divisional chemical, this is the Engineering Directorate. It's more on the better understanding how the brain circuits, brain networks work. These are all health-related activities been funded and funded very nicely, very well funded by NSF. Let me talk a little bit about a program near and dear to my heart, the Partnerships for International Research and Education, a program that I was at NSF at its ground stage, at its development back in the 1980s, actually late 1980s. I remember at that time, the the director of NSF came in and said, I want a program that's going to fund international research and just fund international research, a well-endowed program that's funding it at a very good level. I want to send a message out to all researchers that I want international funding. PIRE, Partnerships for International Research and Education. Again, this is a program focused on funding the U.S. side of the international partnership. The foreign collaborators obtain funding from their own sources. And we've worked together with funding agencies around the world. NSF has worked funding agencies around the world, including Japan, China, UK, Switzerland. All the major funding agencies are partners on this program, leveraging funding to address some of the world's pressing issues. So PIRE also strengthens the collaboration among and within U.S. institutions. So in this program, you can have partnerships, domestic partnership and international partnerships. You can create a huge network of research partners to address some of your research. Right now, this program is archived. It is under development. They're planning on changing it. I don't know what they're going to do. It's possible they could have PIRE Heavy, PIRE Light, something, $1 million proposals to $5 million proposals. I just don't know. My colleagues tell me it was supposed to happen by December, but you know how it works. The gears of government operate very slowly. So keep this one in mind. And actually, we have been successful. City College did receive a PIRE award about 3 years ago. This is the engineering director. The chemical engineers up at City College received this support. But this is an area that I think we should keep our eyes open to. International research experiences for students. Again, the focus is on getting students out internationally to support U.S. undergraduate, graduate students to conduct high-quality research abroad in collaboration with foreign investigators. So proposals are, I understand that they've revised the solicitation now. They have a track 1, track 2, and track 3, $300,000 for research sites, track 2, $400,000 for advanced studies institutes, and new concepts and international graduate experiences, $1 million. So it really does depend on the extent of these collaborations, how you want to build them. If you're just looking to bring students abroad just for a summer, or I think they're 3-year institutes, so it would be 3 summers, I would suggest the research sites, the 300K. If you want to build something a little bit more, larger, build institutional commitments on the part of institutions, so that's 400K. And then if you have a new concept in terms of how you want to deal with this international graduate experience, I haven't seen any of these funded, but it's always the first time. Okay. Annual deadline on this one is the 4th Tuesday of every September. I think if we're going to do something internationally, CUNY is ripe for something like this. I haven't seen any CUNY awards made on IRES. So we'll talk about BRAIN, the BRAIN initiative. Slowly running out of time. This is a program that joined NSF, NIH, FDA, and DARPA, Food and Drug Administration, and DARPA. Again, the goal of this program is to generate an array of physical and conceptual tools needed to understand how healthy brains function over the lifespan of humans and other organisms. Develop, and also there's a workforce component to this, to develop a workforce aimed at establishing and understanding how thoughts, memories, and actions emerge from dynamic activities in the brain. There are dear colleagues letters that NSF has issued here. These are, one is to stimulate integrative research in computational cognition. I mentioned the interagency component. They're also looking at a cross-disciplinary component here, where the social sciences work together with engineering, work together with health researchers, where you have disciplinary expertise across disciplines to address the complexity of the brain. Can only be addressed with a cross-disciplinary perspective. No one discipline can really handle this. It has to be multiple disciplines. Innovative computational infrastructure for understanding the brain. So the brain is one huge computational component. So social sciences play an important role in understanding that. So supplements, again, as well. If you already have existing research that's very closely related and you want to add supplements that has a brain part to it, that dear colleague there does exist. And NSF, NIH, and the federal agencies want to build this National Brain Observatory, which is basically one big, large national brain data system that all brain researchers can go to see what research has been conducted, to see what kind of advances can be made. The Brain Observatory is really an infrastructure for developing everything there is about neuroscience. The other large NSF component that's directly related to health is smart and connected health. This is NSF NIH partnerships that integrates computer, information sciences, engineering, social sciences, economic sciences, all the sciences. So this is smart and health, connected health. It supports network, advanced analytics, sensor integration, privacy and security, and modeling socio-behavioral and cognitive processes. So what are some examples of this kind of research? Canine-inspired detection of hypoglycemia through human breath. Isn't that interesting? NSF funded a project like this. Opioid overdose detection and reversal using sensors and mobile devices. Another NSF funded project. A computational toolbox for big brain data. These are all projects recently supported by NSF. So this is another one. If your field is directly related to anything, or if you want to develop some partnerships in these areas, I think this is another one that you want to consider. Annual deadline, December 11th. Just missed it. But it's going to take us that long to develop a proposal for the next deadline, December 11th of 2020. Maximum duration 4 years, maximum amount $1 million. Then there's partnerships for enhanced engagement in research. What is this? This was created by NSF to help foreign researchers. This is available to foreign researchers, but not foreign researchers in advanced countries, foreign researchers in developing countries. So if you have researchers in Honduras, Guatemala, El Salvador, African countries, low-income countries, whose funding establishments, whose research establishments are not well developed, and you want them involved in your research, you should work with them to submit a proposal, a peer proposal. This is a USAID also supported effort, NSF, USAID, and the National Academies is actually runs the program for NSF. So it's about building capacity in other countries as well, and supporting scientists in those developing countries. Keep this one in mind, especially if you have colleagues who you've been working with who are having difficulty in these low-income countries. Maximum duration 12 months, maximum amount $75K, which goes a long way in some of these developing countries. Student travel, of course, is encouraged. Okay, so let me, I talked a lot about NSF. Let me say something about private funders in health. Who are some of the major funders in health? And they're funding quite a bit. The Wellcome Trust Foundation in the UK, almost $1 billion in health. A lot of money. Howard Hughes Medical Institute, $752 million. Cancer Research UK. The UK seems to be, when it comes to these philanthropic organizations, it seems to be, and health seems to be pretty high up there. Bill and Melinda Gates Foundation, Institut Pasteur in France, and then the list goes on. I mean, you know, a lot of the ones we're very familiar with: American Cancer Society, British Heart Foundation. Keep these in mind. I suggest that there's more on our website, the APPS website. Keep these in mind and come and talk to us if you really want to submit a proposal, if you have an idea about submitting some of these philanthropic organizations. I wanted to also share with you one last thing before I turn it over. What I did is I did a search on total active grant solicitations by federal agency. And of course, NIH came up, 1,000 active solicitations. Number 2, Agency for Healthcare Quality and Research Quality, 19, again, within HHS. Health Resources and Services Administration, 16. SAMHSA, Substance Abuse and Mental Health Administration, 16. Centers for Disease Control, 8. USAID, 7. State Department has some health-related research activities, and also the Department of Defense, last but not least. Now, keep your eye on the Department of Defense because they do issue solicitations from time to time that are directly related to health. There aren't too many out right now, but there is an active health research going on at DOD, and they do support grants in health. So let me end with that, and if you have it, I'm going to take 2 questions because I think we don't have too much time.